Post-fall management is presented by Lorraine Lovett, a Senior Improvement Lead in the Older Persons Patient Safety Team at the CEC. She will share the clinical processes to follow when a patient has a fall in hospital.
The Comprehensive Care Minimising Harm framework includes post-fall huddle, an important component of safe, quality patient care. A fall event can be serious and cause injury and even death. In hospital, a patient fall can be a flag that the patient's underlying medical condition may have changed or deteriorated. The causes for falls are complex, and staff are required to attend immediate post-fall care. What we know is that many falls are unwitnessed. A review of fall incidents highlights that often clinical issues are not identified prior to the patient falling and a plan of care in place. The clinical processes to follow when a patient has a fall in hospital is to ascertain why the patient fell. We need to identify what were the contributing factors, to communicate with the attending medical team and the patient's family carer re the incident, attend to any clinical issues that may have eventuated, and to revise the patient's care plan. The CEC has developed a post-fall guide to support clinical actions for a patient fall. It aligns with the CEC between the flag system, and staff are to follow their local clinical emergency response systems. The immediate response required is when a patient has a fall, staff are to undertake rapid assessment and basic life support if required, and complete observations and check for any injury. Call for a medical review to undertake a clinical review of the patient. Key areas to be considered: does the patient have a fracture, possible head injury, sepsis and/or a delirium? The patient's family carer to be contacted and notified of the incident. Ongoing observations including neurological obs, as the patient may develop symptoms that can indicate serious changes in their condition. It is important to note that older people who fall in hospital are at risk of intracranial injury due to physiological changes in the brain. This means that any patient who falls is at risk of a potential head injury. Patients who are on anticoagulants are at increased risk of having a bleed, and staff are to be aware and to monitor vital signs. Early signs of deterioration include fluctuating behaviours such as increased agitation, restlessness or changes in alertness, lethargy or increasing confusion. Ongoing monitoring and reporting of such changes is a clinical imperative. The patient care plan is to be reviewed and discussed with the patient and family. Communicate the changes in care and your observations of the patient at clinical handover and at safety huddles. A post-fall huddle with patient, family, carer and key staff as soon as possible after the event is to be conducted to clarify why the patient fell and to revise the care plan, implement strategies and document to prevent a further fall. The post-fall huddle provides important information which can contribute to a serious incident review. Your patient, Mr. Long, who is confused and has poor mobility, has had an unwitnessed fall and you have found him lying beside his bed. What actions do you take? Why did Mr. Long fall? A post-fall huddle is conducted with members of a multidisciplinary team, for example the nurse, the physiotherapist, occupational therapist, social worker and medical staff where possible. Some of the things to consider: was Mr. Long's wheelie walker close by and within easy reach? Was the bed at the right height, too high or too low? Was he able to sit and put his feet to the ground? Did he stumble trying to get out of bed? Was he reaching for things such as his glasses or a newspaper? If Mr. Long needed assistance to mobilise to the toilet, when was the last time he was assisted? Was he anxious to get to the bathroom? As he was confused, he would not necessarily remember to use his call bell. Did Mr. Long have a delirium and a delirium screen attended? And had this been escalated to the medical team? Was a family member able to attend the post-fall huddle? Family members may highlight issues that they are concerned about in relation to his condition. What can we learn from this fall to prevent Mr. Long falling again? but also to consider what actions can be taken to improve the care of all patients on this ward to prevent further falls. Resources are available on the CEC website.